Hi, my name's Jacqueline Wilkinson, and I'd like to thank everyone for coming and taking some time out of your busy schedules to participate in my last public speaking speech. The title of my speech today is What You Can Do to Keep from Becoming a Victim of Drug Resistance. Lana Kuykendall, a 36-year-old South Carolina mother, delivered twins and shortly after became infected with the flesh-eating bacteria also known as necrotizing fasciitis. Necrotizing fasciitis is caused by a strain of bacteria that is resistant to standard first-line antibiotics. Bobby Vaughn, a 32-year-old landscaper, was also diagnosed with the flesh-eating bacteria, as well as Amy Copeland, a 24-year-old grad student from Georgia who fell during a zip-lining accident and had to have her left leg, right foot, and both hands amputated to save her life. Drug-resistant bacteria is increasingly causing infections in healthy people. According to the CDC, drug resistance is one of the world's most pressing health problems. Drug resistance is everywhere. There is drug-resistant pneumonia, drug-resistant sexually transmitted diseases, and drug-resistant skin infections. The people infected are more likely to have longer hospital stays and more likely to die because of the infection. Penicillin was once a miracle drug and was used in the 1940s to kill everything. But before World War II, that's a tongue twister, sorry about that. Before World War II had ended, penicillin had developed some resistance, according to the Encyclopedia Britannica. So today, I would like to, 1, define what drug resistance is, 2, persuade you to resist the urge to run to your doctor's office to get an antibiotic the next time you're sick, and 3, explain how you can protect yourselves from becoming a victim of drug resistance. First of all, what is drug resistance? Antibiotic resistance is when germs mutate or change in a way that reduces or eliminates their effectiveness. According to Medscape, the bacteria has grown immune to the antibiotic. So what may have killed a certain germ 10 years ago no longer works because the germ has become familiar with the drug and has figured out a way to survive anyway. Overuse of antibiotics is making drug resistance worse, not to mention increasing allergic reactions, side effects, diarrheal infections, and even death. So, how do you know when you really need an antibiotic? You are sick, or your baby is sick, coughing, sneezing, you have a bit of a stuffy nose, and you're just feeling miserable, so you go to the doctor because you want an antibiotic so you can feel better. However, most cold and flu symptoms are viral. Antibiotics don't kill viruses. According to the CDC, antibiotics were prescribed in 68% of acute respiratory tract visits, and of those visits, 80% were unnecessary. The average cold lasts for 7 to 14 days. So how do you know when you should go to the doctor? If your signs and symptoms last for more than 2 weeks and you're feeling worse instead of better, go see your doctor. Keep in mind, some doctors are the problem because they prescribe antibiotics when they are not needed, either because they feel your pain or they feel pressured to do so by you. Some doctors will actually prescribe more expensive drugs just because the patient asks for them. So it is imperative that you know what you're asking for, because we now know that antibiotics can harm someone with a viral illness by increasing the risk of a more serious infection or creating an antibiotic resistant strain of bacteria. This is a campaign from the CDC that basically encourages people not to use antibiotics, and it's going to be a week in November of this year. They encourage people not to use antibiotics when they're not needed. Now let me tell you how to protect yourself from a drug-resistant infection. Excuse me. If you're prescribed an antibiotic for a bacterial infection, not a viral infection, number 1, take it exactly like it's directed. Do not skip the doses. Number 2, finish your supply. Do not stop taking it even if you feel better, or try to save any for the next time. Usually, if you're taking an antibiotic in 48 to 72 hours, you start to feel a little bit better. So that'll make you think, okay, I'm better. I don't need it. I'm going to save this for the next time. Don't do that, because the bugs just come back stronger. And number 3, only take the medication that's prescribed for you. Different people require different doses because of weight and things like that. And different antibiotics treat different things. For example, certain drugs kill respiratory bugs, and certain drugs kill urinary tract bugs, and certain drugs kill skin bugs. Also, to prevent infection, practice good hand washing all the time. Always good hand washing. And 5, do not ask for an antibiotic if the doctor doesn't think you need one. So don't beg him for an antibiotic when he says no, you don't need one. Just leave it at that. So today I have defined drug resistance, explained the dangers of drug resistance, and advised you of what you can do to protect yourself and your loved ones. I hope that I have convinced some of you to reconsider asking for unnecessary and sometimes detrimental medication. Thank you all for coming. I appreciate your time and patience.